Miranda Cully, and this is my pulse assessment number 3 for PN 126, and I'm a nursing student at Nightingale College. First off, I'm going to gather supplies. I'm going to have my stethoscope, a pen light, and infection control to wipe down my stethoscope, and something for smelling, and clean gloves here. So to start off with, I'm going to come in and close the door or the curtain and provide privacy for my patient. Hello, my name is Miranda, and I'm your nurse. Can you verify your first and last name?
Chance Weaver.
And your birth date?
10/5/85.
So I just identified my patient using 2 identifiers. So Chance, today we're going to be doing an assessment that kind of starts with the top of your head, kind of looking down at your skin, checking some of your cranial nerves. We're going to listen to your lungs, your heart, and we're going to do your abdomen and check some peripheral vascular also. Do you have any questions, comments, or concerns?
I don't.
Okay, if you do at any time, please don't hesitate to stop me and we can address those. Are you in any pain right now?
No.
No? Okay. Do you have any allergies?
No.
No? And I'm going to ask you a couple silly questions. Do you know where you are right now?
Yep.
Can you tell me where that is?
Home.
I'm going to perform hand hygiene. Can you tell me what we're doing?
My nursing video.
Okay. Can you tell me what day it is?
Thursday.
Awesome. Okay, so then I would document that my patient is alert and oriented to person, time, place, and situation. And then I also am kind of looking at general while he's talking to me, his mood, the way he's talking to me. I am getting a little bit of tiredness going on, which is understandable since it is later in the day. My patient's appearance overall is well kept. Hygiene is kept up also. And then mood in effect. Mood is in good spirits besides being tired. Then I'm going to put on some gloves here after I perform hand hygiene. Okay, we're going to start with getting a full set of vitals. So I'm going to get your pulse. I'm also going to get your blood pressure, your body temperature using a thermometer. I'm going to get your respirations, and we're also going to get SpO2. So pulse is regular at 2 plus on the peripheral for the right side, 2 plus. And then on our left side, I also have a 2 plus peripheral. And then I also am feeling skin. The skin is warm. The skin appears to be dry. Skin also appears to have no contusions, abrasions, lesions, no masses or deformities are noted as I am looking at the skin. And skin tuger is normal. And then also cap refill is under 2 seconds. And then while I'm down here too, I'm looking at the nails. Nails are round and are well kept and clean. And then just in general appearance on we have a little bit of hair loss on top, but otherwise hair is thick and appears to be healthy. Symmetry-wise on facial features, while I'm looking, eyes appear to be symmetric bilateral, ears are symmetric and proportionate to the face. The same with facial hair, it is clean, no dandruff or flaking in the skin. Kind of coming down and looking, I don't see any tracheal deviation or no pulsating from my cervical, or from my, we're just gonna move on here because I forgot my words here. But, so I'm gonna start palpating here. I don't feel any cervical lymph nodes. I'm gonna check your pulse over here. And then bilateral, left and right side are both 2+. of our cervical pulses, and then pin light. I'm gonna check in the ears. No drainage out of our right ear, no drainage out of our left ear. And then if you look at my nose, I'm gonna check your pupil responses. Look at my nose. Okay, pupils are 3 millimeters, reactive, bilateral. Can you go ahead and close one nose and breathe through it, and then the other side and breathe through it? So our nasal passage is patent. Can you stick your tongue out and say ah?
Ah.
I'm also looking inside the mouth. Mucosa is wet, moist. Lips, there's no cracks or lesions on our lips. That cranial nerve's intact. And then, can you clench your teeth? That cranial nerve's intact. And then we're gonna have you shrug against me here. Perfect. That cranial nerve is also intact. And then the whispering test, I'm gonna whisper in your right ear, and I'm gonna have you say it back to me while you hold. Yeah, there we go.
20.
And then on this other side.
20.
Okay. So our whisper test is a pass, and we're also gonna do our 6 cortical fields of vision, looking for any bouncing of the pupil or the eye. Okay, ready? Perfect. No abnormalities there. Peripheral vascular, as we had noted before. I checked pulses on both sides. They're both 2+. Coming down, I'm going to check your brachial, or popliteal, my bad, which is the one right behind here. That is also 2+. Right here, sorry, 2+. And then we're going to slip the socks off. While looking, I'm going to check for any edema. Patient has no lower extremity edema. Pedal pulse is 2+ bilateral. And then moving on to heart. I'm going to listen to your heart now. All right, took your socks off. Okay. I'm gonna flip around here. Okay, S1 and S2 are audible. S3 and S4 are not, and there are no gallops or any extra sounds. And then I should have had mentioned this before. I would have listened to the heart with no clothing on, because clothing can cause interference and add noise. But for my patient's modesty, I'm not having him take his shirt off, but I would want to perform this without any clothing. So I'm going to listen to your lungs now. If you'd sit back up for me. Deep breath. We gotta listen to the 9. Patient has clear lung sounds bilaterally with no adventitious lung sounds. Prior to auscultating, we would want to look at our chest anteriorly and posteriorly, look for any work of breathing, any use of accessory muscles, which would say that our patient is in distress, which also notes as in doing a respiratory assessment, around the patient's nose and mouth, those are all pink, so there's no indication there, or within the peripheral hands and feet, the skin is also pink, noting that we have no signs of respiratory distress at this time. Okay, I'm gonna have you lay down. And hopefully we'll still be in the.
Oh yeah, I'll stick it in the frame.
Okay, I'm gonna check your belly. Okay. So first of all, we want to inspect. So I'm gonna look at the belly. Appears to have a roundness and shape. Not seeing any abrasions, contusions, or any lesions on the skin of the belly. Then I'm going to auscultate. I'm gonna go. I'm listening for a gurgling sound. If I was appropriately doing this, I would want to listen for over a minute and count how many gurgling sounds I'm getting. For it to be normal, it would be between 5 to 35 gurgling sounds. So my patient has normal, we're gonna say normal, normal on auscultation, and then I'm gonna palpate. Just let me know if anything hurts. Okay. So, no masses or deformities felt on palpation, and my patient had no complaints of tenderness or pain while palpating. Just kind of gonna go generally over. We check peripheral, abdomen. We'd also want to palpate chest for any abrasions or contusions, deformities in the bone, posterior and anteriorly. The other thing we'd want to check is the Snellen chart. We would want the patient to be 20 feet away from the chart, and they would start by reading the smallest line that they can read correctly, and then cover one eye and read the smallest line they can correctly, and then with their opposing eye, and then that would be charted as, for my patient, I would chart it as 20/20 bilateral, or 20/20 vision in both eyes, 20/20 vision in right eye, 20/20 vision in left eye with uncorrected lenses. That's how I would chart that. And then we could also check closeness too with at 14 inches with the Snellen chart, doing the same process. At this time though, I'm going to make sure you're comfortable. Ask if you want your socks back on or not. No? Okay. I'm going to make sure you have your collar light. Do you have any questions?
Nope.
No? Okay. I'm going to take my gloves off, put them in the receptacle. I'm going to clean my stethoscope and my hands, of course, and document all my findings of my assessment.